already.
Okay, great. Hello, Cindy. Thanks for coming in today.
Yeah.
Great. This initial session is going to be a little different from all the rest. I'll just be gathering lots of information just to kind of see where you're at.
Okay.
Anything you don't feel like you want to answer, please don't hesitate to say no, or if you don't have an answer, or if you need to think about it, you can come back.
Okay.
And then I'm just going to look at this information and kind of see where you're at. And if there's anything else that you would like to add, like if I'm not asking enough questions, you let me know, okay?
Okay.
Okay, perfect. So did you receive these forms?
Yes, I have.
Perfect. And so, Cindy, how old are you?
I am 23.
23?
Yes.
And what is your marital status?
I am married.
Married? And how long have you been married for?
Just a little over a year.
Excellent. And do you guys have any children yet?
We don't, but we will in May. So only 4 months away from having a baby.
Oh, nice. And how's the pregnancy going?
Well, that's kind of why I came in today. I feel like just with going through the pregnancy so far, with my job and with everything that I have right now, I just feel really overwhelmed, and I just have felt my anxiety has just been increasing. And so it hasn't been going the best, but I'm also excited at the same time. So I think that's a lot of like what I want to focus on for counseling.
Great. Thanks for sharing. And absolutely, we can look at that as one of your goals in focusing. But today, I still just need to gather all this information.
Okay, that sounds fine.
Thank you. So who referred you to come into the office today?
Nobody. I just was searching online and just found this practice and just wanted to start seeing somebody for myself.
Mm-hmm. Okay. And have you previously participated in psychotherapy?
No.
No? First time?
Yes.
And so are you currently taking any prescribed medications?
Nope.
Okay. And so when you were looking for a counselor, what were you looking for?
Well, I was looking for someone who, I don't know, I guess I like the thought of having someone who also is Christian and could talk with me about those things, just because that's such a huge part of my life. And I just feel like so much of this applies to my faith and prayer and like just how I see myself as a part of the world. And so I kind of just wanted somebody who was practicing as a Christian counselor.
Mm-hmm. Okay. Well, you have that in me.
Great.
So how is your physical health currently?
It's pretty good. I say it's kind of declined with my pregnancy just because I've been so exhausted, and so it's good. I'm still pretty healthy and everything's going fine with me and the baby, but just me personally, how I feel, I've just felt a lot more tired and sluggish, like I'm sure any pregnant woman is.
Right. And so, so the physical symptoms that you're listing right now is tired.
Yeah. A lot of headaches. I have a lot of headaches, and just like a lot of chronic pain, which I had that before my pregnancy, but I just feel like it's gotten a little bit worse because I haven't been able to work out or exercise as much. So just the chronic, like I have really bad back pain a lot of the time, and then the headaches, I'd say, would be the two biggest problems that affect me daily.
Mm-hmm. And chronic pain, and you say that affects you daily?
Yes.
Mm-hmm. And what are you doing to treat your chronic pain?
Well, nothing really right now. You can't really take anything for it just because, well, during pregnancy you can't take anything for it. But I try and keep a healthy diet and just exercise as much as my body allows. And that seems to help my back pain not be as bad, and it just kind of gets my muscles moving, and it just doesn't hurt as bad as long as I'm, eating right and exercising. Then I feel like when I wake up or when I have the aches and pains, they're just not as aggressive or as bad as if I'm just like laying around all day.
Mm-hmm. Mm-hmm. So to help with your pain, you try to get some exercise and eat a healthier diet.
Yes.
And you mostly feel these aches and pains when you first get out of bed in the morning?
Mm-hmm. Yeah, that's when it's the worst.
That's the worst. Stiffness from being still.
Yes.
Okay. And so talking about getting out of bed in the morning, tell me about your sleep habits.
I'm pretty good sleeper. I don't wake up in the middle of the night. Never really have. Sleep has always been, I can sleep because I'm pretty tired. The only thing is just I've just been extra tired lately, just kind of with that overwhelming stress with work and the pregnancy and everything. So sleeping is fine. I'm just still tired, I would say, is the only thing I would mention about sleep.
Mm-hmm. So what I hear you saying is that when you go to sleep, you're able to sleep and not wake up, and sleeping's good.
Mm-hmm.
And so about how many hours a day do you try to sleep?
8 to 9.
8 to 9. And so about what time do you go to bed at night?
Well, I try to go to bed by at least 9 o'clock.
And you're getting up about 6 in the morning?
Mm-hmm.
Okay. Nice. And how about your husband? What's his sleeping pattern? Do you together, first of all?
Yes.
Okay,
Yeah.
I didn't want to assume that you guys were sleeping together.
Mm-hmm.
Is he about the same time as you do, or?
Yeah, he usually, the only thing is he wakes up before I do by a couple hours.
Mm-hmm. So he's sleeping about 9 to 4?
Yes.
Mm-hmm. Okay, and that doesn't wake you when he gets up in the early morning?
It does. It just depends on if he's getting up right away with his alarms or not.
Mm-hmm.
But most of the time, it doesn't. I'm a pretty hard sleeper, so.
Mm-hmm. Good. And then when you're feeling tired during the day, do you think about taking a nap, or?
Yeah, I'm always thinking about taking a nap for sure, but usually I don't have, just with my schedule and just all the stuff I have on my plate, I don't usually ever nap. And then I don't really do caffeine or anything like that either, just because they say you can with pregnancy, but I just don't, just because I don't want to risk anything.
Mm-hmm. Sounds like you're trying to take care of your unborn child by not drinking caffeine and pushing through the tiredness.
Right.
Mm-hmm. So earlier you mentioned exercising to help with your chronic pain. About how many times a week do you exercise?
I would say probably 3 to 4 times a week.
3 to 4 times? And what does an exercise session look like for you?
I either do yoga or I swim, just because anything else kind of hurts my muscles and joints way too much. Like weightlifting or running, it's just too hard on my body. So
Mm-hmm.
I do a lot of swimming and yoga.
And so when you're doing this yoga and swimming, about how long do you do it for in a session?
Oh, just probably an hour.
An hour? And are you doing that with somebody, or with your husband, or by yourself?
It just depends. Sometimes it's by myself. Sometimes I'll meet friends or my mom or my husband, if he's off work, will go with me.
Mm-hmm. And so is that something that you have scheduled on the regular, or just when you have time to squeeze it in?
Just when I have time to squeeze it in.
And you're still squeezing in an hour of swimming or yoga 3 or 4 times a week?
Yeah.
Okay. Thank you. And so earlier we started talking about some of your eating habits, that you try to eat healthier, and you're not doing caffeine while you're pregnant.
Mm-hmm.
How would you best describe your eating habits?
I eat pretty regularly just because I'll get sick if I don't, just with the baby. So I'd say I eat quite a few small meals every day, instead of, I don't really sit down for I do for breakfast, but not like lunch and dinner. I kind of eat like a couple hours before lunch, a couple hours after, just because with the baby, it's kind of just depends on how I'm feeling or if my stomach hurts or whatnot. But I eat pretty regularly. I don't really have any problems with that.
So help me to understand regularly. So you eat breakfast, you eat lunch and dinner, but you also eat a couple hours before lunch?
Yeah, I just kind of have to have snacks because I've been so sick with the pregnancy, so I kind of have to keep eating to not get sick or have a stomach ache.
Uh-huh. So eating regularly, it includes like 3 meals a day plus about 2 or 3 snacks a day.
Yep.
Mm-hmm. Nice. And that helps you with not feeling as sick with the pregnancy and giving you energy to keep going.
Right.
Mm-hmm. Excellent. And when you're eating those snacks, what does a snack look like to you?
Fruit or vegetables.
Fruit or vegetables? Mm-hmm. Is there anything that you don't like to eat?
Sometimes meat. I don't really like to eat. It just doesn't seem, yeah, I just don't like it as much. I don't know.
That's okay. We can't all be carnivores, right?
Right.
Right. And so with the new stress of being married and going to school and working and being pregnant, do you find yourself eating more, eating less? Do you feel okay about your eating habits?
I feel pretty okay about my eating habits. Yeah.
Okay. Not a concern that you're concerned about?
No.
Okay. Good to hear. What about alcohol use, or do you use alcohol or tobacco at all?
No, I mean, I obviously don't now, but I didn't really before all either. Just never really something it's just not a part of my lifestyle or my group of friends or anything like that.
Mm-hmm. And recreational drugs?
No.
Mm-hmm. Okay. We're going to kind of take a different direction here and talk about the ways that you, about your romantic relationship.
Okay.
So you are newly married.
Yep.
And how is marriage going?
Good. Yeah. I feel like, everybody has their ups and downs, but we work on things and we're a pretty good team. So we make things work.
Mm-hmm. And would you say that you're happy being married, or you would have been better off single, or?
Oh, definitely better married.
Better married.
Yeah.
Hey. Nice. And how long did you guys know each other before you got married?
About 5 years.
5 years. And during that time, were you guys involved with a community, with your families? Has that changed much, or?
So we met at church and we're still part of that same church. So
Mm-hmm.
yeah, it's a bigger church, so we didn't really know each other until we got a little bit older, but we were both there when we were younger as well. And then we still go to that church and both of our families still go to that church. So.
Mm-hmm. And so would you say that your relationships have changed much with the people that you knew before you were married, or?
Oh, no, definitely not. We kind of have the same group of friends, and yeah, we've stayed the same with our church community.
Nice. And so on a scale of 1 to 10, how would you rate your current relationship with your husband?
No, probably a 9. I guess things could always get better. And I feel like even month after month, just knowing each other and getting to know each other even better, it's gotten better. So I'm sure it can get better. So I suppose that's why I won't rank it a 10, because I know we'll get stronger and whatnot. And especially with the baby coming.
Right. Right. And how about with your family? What's your relationship with your family? How on a scale of 1 to 10?
A 10 for sure. I'm really close with both my sister and my mom and dad. So we
Mm-hmm.
talk all the time. Weekly for sure, if not almost daily with my mom. So I have really strong relationships with my family.
Mm-hmm. Strong relationships with the family. How about with your husband's family?
We don't see them as much. They live a little bit. I think my husband just has a different relationship with his parents than I do mine. I just am always talking with them and things like that. So we have a good relationship with them. We just don't see them as much as we see my parents.
Mm-hmm. Okay. Mm-hmm. Makes sense. So we have this whole list of things here that we're going to talk about. Switching gears again, if you've experienced. Okay.
Okay.
So have you ever experienced depressed mood?
No, I wouldn't say that. Just like sad sometimes.
How about mood swings
Yes.
and rapid speech
No.
and extreme anxiety,
Yes.
panic attacks,
No.
phobias,
Yes.
and what is a phobia that you have?
Just I just am like afraid of like getting sick all the time, like just with germs and just with other people being sick and or just me getting something that isn't curable and that I'll die or something like that.
Mm-hmm. How about sleep disturbances,
Nope.
hallucinations,
Nope.
unexplained losses of time,
No.
memory lapses?
Nope.
So on the alcohol substance abuse, you said no,
Nope.
but is that no previously as well?
Right. Yeah. Nope.
Okay. Frequent body complaints,
Um,
like the chronic pain.
yeah, if it has to do, yeah, chronic pain, then yes.
Mm-hmm. So an eating disorder,
Nope.
body image problems,
Nope.
repetitive thoughts of like obsessive thoughts.
Yeah.
Mm-hmm. And what about repetitive behaviors like frequent checking or hand washing or
Yeah,
like,
I guess I do that with some stuff. Just like checking on, not as much like the hand washing, but I just have to like double check everything, I feel like.
double checking everything?
Mm-hmm.
And everything, what is that?
Just like making sure I locked my car, and making sure I shut the oven off like a bunch of times before I leave the house, or double checking I blew out a candle or turned off my hair curler. Just always like second guessing myself, like if I actually turned it off or if it's still on and it's going to burn my house down.
Mm-hmm. How about homicidal thoughts?
No.
Never thought of killing somebody, huh?
Nope.
Okay. Have you ever attempted suicide or had suicidal thoughts?
No.
Mm-hmm. So this is some current information about you. Where are you currently employed?
Lutheran Church of Hope. It's my home church.
Mm-hmm. Oh, what do you do for Lutheran?
I'm a children's ministry director.
Oh. Um, so I have to this is just on a side note. So I would want to share something with you right now, but I have to remember this is your time, not my time.
Mm-hmm.
And as a therapist, I'm just thinking, and so it's always that fine balance, but I used to teach at a Lutheran church myself.
Okay.
Yeah, and so anyway, I was thinking to share that with you.
But
I had a paid teaching position. They had a school in the church, and I taught at the school.
that's cool.
But currently, I serve in children's ministry at our home church on Sundays and Wednesdays.
Yeah.
So we had to have a long talk with our children's ministry director. But anyway, I'm all thinking to tell you that kind of stuff. But we actually wouldn't do that in a therapy session because this is your time to tell me, and I don't want your time telling you my story.
Right. Okay. That's a good note. Thank you.
I was thinking about. All right. Did you want to share your religious, spiritual information with me?
Sure. Yeah. I just practice Christianity, and I've grown up Lutheran.
Mm-hmm. And earlier you said that's a big part of your life.
Yes.
Okay. So what about your family mental health history? Has anyone in your family ever experienced any of these following difficulties? And if so, who? Okay.
Okay.
How about depression?
No.
Bipolar?
No.
Anxiety disorder?
Yes. My mom.
Mm-hmm. And how about panic attacks?
Not that I know of.
Okay. Schizophrenia?
No.
Alcohol abuse?
Nope.
Eating disorders?
Nope.
Learning disability?
No.
Trauma?
No.
Suicide attempts?
No.
Okay. Okay. So, in closing here, I want to just ask you a few more personal questions.
Okay.
What do you consider are your strengths?
I'd say my strengths are connecting with other people and empathy. I'm just really good at just being able to kind of, see people where they're at and understand what they're going through. I've always felt like that was a strength of mine.
Mm-hmm.
And I'd say I'm also really consistent and just dependable.
Dependable and consistent.
Mm-hmm.
Okay. You want to bring your drink and we'll fill you up? Excellent. So what I heard you say was that you're good in connecting with others in relationships and having empathy, understanding where they're at,
Mm-hmm.
and that people consider you to be dependable and consistent.
Yes.
They can count on you.
Mm-hmm.
Excellent. What do you most like about yourself?
I most like about myself that I'm a hard worker and that I'm like a really good team player, and that I like to just kind of like be the uplifting person in the room rather than kind of bringing everyone down. I always try and like bring everybody back up.
Mm-hmm. The encourager.
Yes.
Mm-hmm. And what do you like most about your body?
That I can have babies.
That you can have babies.
Yeah. I've always wanted to be a mom.
Oh, exciting times are coming. So what are effective coping strategies that you've learned? Like when you're really struggling or you're feeling anxious?
I feel like I've learned like breathing techniques, but I don't know if that's like helped me that much, or maybe I'm not doing it the right way. But I've also learned just to just remove myself from the situation and just take time for myself to kind of like just breathe and just try and step back. But I feel like that's kind of why I came in today, just to hopefully like learn more about coping strategies for myself, because I don't feel like I do a good job at it. But I'd say like one thing I do is like I'm a really good planner, because I don't like to get overwhelmed, and so I try and plan things out ahead of time. So I'd say that's one strategy that I know about myself that I try and do.
Mm-hmm. So having a plan in place helps you feel like more in control.
Yes.
And reduces anxiety.
Yes.
Mm-hmm. And so when you talk about reading strategies, reading techniques, what is a reading technique?
Oh, breathing.
Oh, breathing.
Yeah.
I thought, what is reading? Okay, breathing techniques. Mm-hmm.
Yes.
Okay. Excellent. Okay, so what are your goals for therapy?
I think my goals for therapy are just kind of to be able to like express my thoughts and how I'm feeling about just what's going on in my life to somebody who like isn't like a part of my everyday life, because I feel like I'm able to do that with the people in my life, but I just feel like it'd be good to talk to somebody who like doesn't necessarily know me every day, and just being able to express kind of how I'm feeling I think will be good for me. And then just finding more coping strategies that work for me personally, especially with getting further along with my pregnancy, and I just don't want my anxiety to increase. So just working on things that I can help myself with in the future, like just with having the baby and then with the baby, because I already know that I'm going to worry about everything. And so just different coping strategies for my stress, not getting too overwhelmed, and then anxiety as a whole.
Mm-hmm. So what I hear you saying is that you want to learn how to identify and express your feelings to somebody outside the family.
Mm-hmm.
And the other one is to identify and practice using some coping skills to help you reduce your anxiety and stress with reference to having the baby.
Yes.
Excellent. Well, thank you so much, Hannah, for coming in today. I was able to ask you lots and lots of questions. Do you have any questions that you have for me?
I don't think so. Maybe like, how often should I come to counseling?
Uh-huh. So we usually recommend about once a week.
Okay.
For about a 45-minute to an hour session. We can start from there and see how things are going.
Okay.
And if there's a time when you think that you need more or you need less, we can talk about that too.
Okay, that sounds good.
Okay, great.
Alrighty.
All right. Well, thanks so much, Hannah, and I'll see you next week, okay?
Okay, thank you.
Thank you.